So we're going to start off our day today by talking about the use of common data elements in COVID research. Today, we're going to be discussing what common data elements are, where they come from, and why they're useful. We're going to review briefly the CDEs that SBE CCC has proposed to be used for measuring COVID mitigation policies. We're going to do an overview of COVID-related CDEs that are already in NLM's repository, as well as COVID-related CDEs that can be found in other sources. And we're going to end with a discussion of new ideas for new CDEs to be submitted to NLM. So let's start with just a level setting of what are common data elements. CDEs are standardized questions, variables, or measures with specific sets of responses that are used across multiple studies. The National Institutes of Health maintain a repository of CDEs on the National Library of Medicine website. So here's one example of a common data element from the CDE repository. Employment status looks like what you might expect to see in a survey questionnaire and an interview. There's a standardized way of asking the question. There's a specific set of possible values. There's links to controlled vocabulary and information about the source of the CDE. And the gold ribbon indicates that the CDE has been endorsed by NLM's CDE Governance Committee. Here's a second example. This one is from a different context, maybe a medical form or a health record. The CDE is part of a form, also called a bundle. We're going to use those two terms interchangeably. There's a link that takes you to the entire set of questions within the form. The form's called Verified Discharge, and our CDE is the fourth of four found in the form. A form is a set of CDEs that are meant to be asked together. And as this message notes, CDEs found within forms are not valid unless they're used with all the other CDEs that are also in that form. In this example, and in many cases, it takes more than one CDE to fully and accurately represent a concept. So we can think of the CDEs as kind of like the granular elements or building blocks of a concept, but when grouped together, they create a more complete picture of the concepts that we want to measure. So where does a CDE come from? They start as variables in research studies. So for example, in a survey, part of a clinical protocol. Many have been scientifically validated. They may be part of widely used existing instruments or scales. It's not required. Some may not be validated and come from other sources. Typically, consensus is obtained via a working group, and there's a process for gathering feedback on proposed CDEs. Working group members are subject matter experts, leaders in their field. And then the last step to becoming a CDE is review by NIH's CDE Governance Committee. CDEs have a lot of potential to benefit social, behavioral, and economic research. To illustrate that, here are three studies that we're talking about over the course of these 2 days, with some key concepts highlighted from those studies. So how do CDEs benefit studies like this? First, they support interoperability in research. Each of the concepts highlighted here, parenting stress, mental health, rural-urban status, vaccine hesitancy, represents one or more measures. Studies that don't define and measure these concepts in consistent ways may reach conflicting conclusions just because of differences in measurement, right? How many news articles, conflicting news articles did we see on the effectiveness of mask mandates? Incorporating CDEs into this research or creating new CDEs as a part of this research can enhance its impact by reducing noise introduced by differences in measurement. Second, you'll notice that some of the concepts being measured here, like race or vaccine confidence, represent complex identities or complex concepts that are not straightforward to measure. There's a lot of nuance. Definitions shift in response to changes in consensus and changes in context, and CDEs can help with that issue in two ways. First, they're domain specific. They can help researchers identify the best measures for their research domain. And also they arise from consensus within a given research domain. So they offer a potential mechanism for capturing current consensus on how to measure these concepts and disseminating that consensus across studies. And then in addition to these benefits, CDEs also just support good general research practices, the fair data principles that underlie open science and data management. During the study design phase, they support interoperability because they employ measures that are common across studies. They support reusability by setting up research data to be analyzed in comparison to other studies. During data sharing and preservation, defining new measures as CDEs supports findability and accessibility by making those measures available in repositories for researchers who are looking for them. And it also supports interoperability by promoting inclusion of those measures into new studies. So I'm going to tell you a little bit about SBE CCC's ongoing efforts to establish CDEs for research into the COVID pandemic. Our first effort has been to define a set of common data elements for capturing data about mitigation policies. We chose to focus on policy measures because health policy in general and COVID mitigation policies in particular have been shown to affect health and to affect it in disparate ways. As this group has repeatedly discussed, and as this map of mask policies from February 2022 illustrates, COVID mitigation policies were not equally distributed geographically during the pandemic. They changed over time, and there were many data sources, each measuring these policies in slightly different ways. So we identified some common data elements that can be used to assess and compare policy data sources. I know this group has reviewed these previously and talked about them before, so I'm going to touch on them pretty lightly here and just mention that these are available on our website if you'd like to read about them in more detail, as well as some information about how we made some of the decisions that we did. These CDEs constitute a form like the example we saw before, because there's more than one variable that's needed to fully characterize a COVID mitigation policy. So if our research question is about the impact of these policies on health, we need to know more than just when the policy started and ended. We need each of these factors, right? Where was it in effect? What kind of policy? Is it a requirement or just a recommendation? Is it a ban? We need each of these factors to build a comprehensive picture of the policy. And so taken together, these CDEs allow users to build measures that will be effective at examining the effects of COVID mitigation policies. So now that we've identified these CDEs, the next step that we want to take is to use them for comparing policy data sources. We started this work in early 2023 and are hoping, hot off the presses, have found a student research assistant to help us with this work in the coming year. So that said, policy is not the only area where we want to focus for CDEs, and it's definitely time to start turning our attention to some new topics. So to that end, we've begun reviewing and identifying existing CDEs that are specifically related to COVID, and that effort is to help us identify topics that aren't covered by existing CDEs or where updates might be helpful now that the pandemic has kind of evolved to a different stage. So I'm going to share with you some of our initial findings from that review. Let's start with an overview of the CDEs that are already published to an LM CDE repository. By my count, there are a total of 398 of them, but who's counting? I'm just going to give you a little breakdown by source. A batch of them, 125 of them, come from an effort called Project 5. There are probably folks on this call who can say more about the history of Project 5 than I can, and I would welcome that input at the end of the presentation. My very high-level understanding of it is that it was a cross-NIH effort to identify CDEs related to COVID from a wide range of research disciplines. Project 5 resulted in the addition of 125 CDEs to the repository in March of 2022. And those CDEs have been reviewed and endorsed by NLM CDE Governance Committee. There are also a batch of CDEs that came from the RADx UP initiative that Patty Brennan spoke with us about yesterday. RADx UP is a consortium of research projects with the shared aim of increasing access to COVID testing in underserved populations. These 234 CDEs were added to the repository back in March of 2021. The NIH RADx UP CDEs they're a set of standard study questions that RADx UP projects are required to use in their COVID-19 testing studies. And these CDEs predate the endorsement process, so they are not flagged as endorsed. And then lastly, there is a set that comes from the COVID-19 Community Survey Question Bank, developed by the CDC as a resource to facilitate use of common measures across research studies. 39 CDEs were added in the very early dates of the COVID-19 pandemic, and they also predate the endorsement process, so they're not endorsed. Here's how the CDEs break down by topic. Broadly, we can kind of break them into 3 topical categories: administrative CDEs, clinical CDEs, and social, behavioral, and economic related. There's just a few CDEs that I would describe as administrative, describing things like, what is the standard way that RADx UP projects collect informed consent, for example. About half of them are what we might describe as clinical in nature. So for example, a good chunk of questions are about testing and diagnosis, either in a clinical setting or self-reported ways of gathering data about COVID testing and diagnosis. Another set are about symptoms. There's a set of for medication and treatments, and a set for medical history comorbidities. Less than half of the CDEs are from social, behavioral, and economic research. So individual demographics make up a big chunk of those. Social determinants of health are a large chunk as well. So some examples of what goes in that category would be things like education level attained, income, employment, including frontline or essential worker status, housing, food insecurity, and access to healthcare. Alcohol and substance use history and behaviors make up another large chunk. There's a set related to attitudes and beliefs about COVID. So for example, questions like, I believe COVID is a serious disease. There's another set related to mitigation behaviors, a few related to trust and information sources. So for example, things like, how much do you trust your contacts on social media to provide correct information about COVID? And a few about vaccine acceptance, like, have you received a vaccine and why or why not? Outside of the NLM repository, we can find a few other sources of shared data elements about COVID. A major one is the Phoenix Toolkit. This is a publicly available web-based catalog of measurement protocols. And at the beginning of the COVID-19 pandemic, Phoenix collaborated with NIH to develop and release a number of protocols for the study of COVID. Efforts are now underway to add about 300 of those variables to the CDE repository. We also talked earlier about RADx UP. Most of RADx's CDEs can already be found in the NLM repository, but the RADx website has been updated more recently than the last round of additions to the NLM repository. So there are some new ones to be found on the website. Of particular note, there are 29 CDEs related to long COVID. And then finally, a working group affiliated with NICHD has recently released this publication outlining CDEs for the study of COVID in pregnant and pediatric populations. So just a few closing thoughts to wrap up what we've observed here. Our consortium is uniquely positioned to propose new CDEs that will support social, behavioral, and economic research. Social determinants of health and substance use behaviors are already quite robustly represented. Doesn't mean there aren't opportunities to add new ones that go in those categories, but they do have kind of the biggest chunk of representation so far. Mental health and vaccination and trusted information sources also are represented, but could benefit potentially. There are opportunities for updates there. Almost all of the CDEs are measuring factors at the individual level. Very few measure kind of broader social context. So that might be an opportunity to think about And of course, there are always plenty of opportunities for completely novel topics.